Hi there, my name is Sarah Hermachea. I'm a registered dietitian and a diabetes care and education specialist. I'm making this video to talk a little bit more about insulin pens. Insulin pens are very commonly prescribed for patients that need to manage their blood sugars more intensively. They can be taken once, twice, 3 times, or even more every day in order to maintain good blood sugar control. Insulin pens are super easy to use so long as patients get adequate and timely training. So stay tuned. In this video, we'll run through how to use an insulin pen and then tips and tricks for troubleshooting with your patient. Okay, so I have in front of me today 2 styles of insulin pens, 2 styles of insulin pen needles, and a small foam injection dummy that we'll use to administer our demonstration injection today. So with most of your insulin pens, they will have a small window at one end that indicates the dose and a knob for which you can dial to adjust the dose. Not all of the numbers will be displayed just because of the size of the window. Some of the pens, when dialed, the button will retract and exit the side of the pen. So this is important when you think about dexterity. Other pens, for example, when twisted, the numbers dial up, but as you can see, the button doesn't retract. So folks will dial to their dose, and then on the other side of the pen is a glass canister and inside or cartridge, and inside this cartridge will contain the insulin. The amount of insulin contained in the pen depends on the concentration. Some pens are designed to carry a higher volume of insulin. Inside the cartridge, you can see a plunger. As insulin is administered, the plunger moves forward to push the insulin out of the top. So a plunger that is all the way forward is likely a pen that's just about empty. So to administer our insulin, we'll also need to use a pen needle. There are a variety of different pen needles. They come in different lengths. They come in different gauges, depending on what someone's used to. There are situations in which a longer needle or a thicker gauge needle might be more appropriate. But for the most part, I would start by prescribing the smallest needle available. There are other styles of pen needles that take into account safety. This type of pen needle will change color when insulin is administered, indicating that the pen needle has been used. It'll also retract into the plastic case so that no one else is at risk for getting poked. So to administer our insulin, we're going to remove the cap of the pen, and of our pen needle, we're going to pull off the paper cap and twist the pen needle onto the end of the pen. We're going to remove both the outer and the inner cap. The insulin pen needle is a very fine needle. This one's a 4 millimeter. Most patients shouldn't feel too much discomfort when administering insulin. Now, anytime you connect a new pen needle, there is some air in the tip of the pen needle. So it's important to prime this pen in order to remove any excess air. So in order to prime, you would instruct your patient to dial to 2, and then they can do what's called an air shot. There's a variety of different places that you can administer insulin. The key is to administer it in subcutaneous fat. So if we were to look at our demo here, most people choose to administer in their abdomen, so a little bit easier to see. You can inject as far down as your hips, as high as your rib cage, and along the side to where the seams of your shirt might be. It's important to rotate clockwise or counterclockwise at least an inch or 2 between each injection site to avoid any adverse complications to the skin. Other injection areas are the thighs, and then you can also do upper buttocks, lower back, and back of the arms. So in order to administer the injection, we are going to dial to a set dose of 10 units. And folks can use alcohol to prep the skin, but it's not required, especially if they do engage in good hygiene or bathing. What we'll do then is administer this injection at a 90-degree angle. So we want the needle to go directly into the skin. This is a very small needle, doesn't need to go in at an angle. Because this is a very small needle, we don't need to use the pinch method. You can read more about the pinch method on my website. So we're just going to do a 90-degree angle straight in, no pinch. Insert the pen needle directly into the skin. And then on the end of the pen, they're going to press and hold until the window dials back to 0. And then they're going to pull the pen needle away from the skin. No need to press or hold or rub. If it's a little itchy, they could put some cream on it or just make sure it has adequate exposure to air. They'll fasten back on the lid or the cap of the pen needle, and then they'll twist off. And this pen needle can be disposed of in a sharps container, and this insulin pen can be stored for use for the next time. So some of the more common issues I run into with folks and insulin pens has to do with the knob and dialing. Sometimes it's very hard to see the numbers in the window. Sometimes people will think or feel that they're not able to dose in 1 increment units because they don't see the number on the window in the display. So just clarifying that you can still dial in 1 unit increment if it's a U100 pen. Another issue I've run into, they'll dial out to dial up to the dose, and then instead of pushing on the pen, they will insert the pen in their skin and then dial back down again. And so the person will not get that insulin if they don't actually push the pen button. They don't actually push the button on the pen. Another issue I see folks run into a lot is not taking off the pen needle at the end of an injection. So a lot of times they'll leave it on, and sometimes they'll just put the cap back on over it, which can cause air to leak into the pen. Or if the pen needle is too long, they will damage or bend the pen needle when they put the lid back on. I hope this video has been helpful in understanding how to teach a patient how to use an insulin pen, as well as some tips and tricks. If you need any assistance in your practice with your patients or with your staff, please reach out to me. I'm happy to consult and help you with this issue.